I've flashbacks from my master's courses. But
Yes.
that was like the kickoff of the class.
Recording.
Because you might chat a little bit, and then it's like, okay, and we're getting into class. It's like recording in progress. It's like a
Yes,
little,
behave. Now you got to behave.
it's just like a little trauma.
The nuns are watching. The nuns are watching you. That's how you know.
100%. Okay, so we are we're week 2 into
week 2
into our everything super patch, super happy.
Super happy hour. Yeah.
And so we wrapped up sleepy time.
Yes.
Last week.
We did.
We dove into the importance of REM.
Yes.
Also had a recap of how to wear the patch.
Yes.
Create that environment.
Yep.
And now, hopefully everyone rate of sleep if they had that patch available. And if they didn't,
yes.
Patch, make sure you check out last week's on Super Patch REM.
Yeah.
And then we'll I don't recommend it wearing for this particular show. All right, we want to keep you awake, want to boost you up. We'll have a very good time. So let's talk about the pain patch. I think we're in week 2, and we were going to say freedom. And I was gonna bring in a clip of Braveheart.
Yes, freedom. Yes.
Right. That's what I always think of. Yeah.
That it is freedom, and actually, the freedom patch is how I got introduced to Super Patch. Because and our friend Mark McDonald, who had that Brinks TV show, we don't do the Brinks thing anymore. He's got his own podcast now on a different part of the interwide web.
Yeah, he's Mark McDonald TV.
No, Mark McDonald TV. He's gotten so bougie. I don't know. Gotten so bougie. But anyway, so we were on the Brinks TV, and I had a recurrent spot there a couple times a week, once or twice a week, where I would do like a little back and forth on gut health, my little gut check stuff.
I remember that.
Yep. And so I was like waiting in the wings on a video conference like this while they interviewed the inventor and CEO of Super Patch, Jay Dollywall. So I had never heard of Super Patch. I certainly did not know who Jay was. And as they were talking, when I listened to what Jay was saying about how what the technology was, how the technology worked, his personal story, I'm getting fascinated. Now, he doesn't even know that I'm there. He does not know who I am. And I'm like, I'm logging on to his website. I think I bought probably $300 worth of super patches in that 10-minute period of time that he was talking to Mark, because I was so fascinated by it. At the time, I was suffering pretty badly with crippling psoriatic arthritis. Medicines were not working for me. The rheumatologist actually wound up cutting me off of all medicines because I refused to take the IV immunosuppressant medicine. Right. I thought that wasn't for me. I wouldn't take it. She took me off all medicines. So now I'm like a crippled up, hobbled mass. And the one thing he talked about was the freedom patch and how it helped with pain. And for me, it was every joint in my body, but probably at the time, the worst pain I had was in my right lateral knee. And I could not support my body weight on it. And which made it really difficult to go upstairs, and certainly going downstairs was almost dangerous. And it'd been like that for a year and just kind of like getting worse. And because of that, I couldn't exercise, and things were just getting worse and worse and worse and worse. So I thought, you know what? Number one, I bought a freedom patch pack. And then number 2, the second they finished that interview, I pipe in. You're not supposed to do that because they're recording, of course, but I pipe in and I was like, I'm sorry, sir. I don't know who you are, but what the hell did you just say? Like, now I'm interviewing him because I want to know. And he and I off air had like some 3-hour long conversation on the technology and how it works. And it took, when this patch arrived, just kind of the way I used it. So I'll start with kind of the suggestion. What he told me personally was, Anna, when you get the patch, He goes, I would have sent you free patches. I don't know why you bought it. And I was like, well, because I don't know that you're going to send me free patches and I want them now. So there you go. He goes, the part that hurts you the most, you only need one patch. Even if a lot of you is hurting, you got joints everywhere hurting. You don't need a patch on every joint, but find the worst joint and put the patch as close as you can to that pain. And then he quoted a study that was out of University of Miami, the anesthesiology pain management research group had done a placebo-controlled trial on this particular patch. And the results were basically within 2 weeks, people were using 80% less medication as a result of using the patch. In other words, it was working and they weren't even asking for medicine anymore, with an 80% sort of reliability as far as how much pain relief. Okay. So that's what I did. I put it on my little, where I thought it was interesting. This is an interesting experience. I put it where I thought the pain was in the morning on my way to work. And after walking around, I asked myself, why did I put it there? Because it seems like it hurts like just below it and to the right. So the next day I took off the old patch because they last 24 hours. And I put it just below where the other one was and to the right. And as that day went on, I found now, actually, the pain's a little bit more to the front on the knee. Okay, so it took 2 or 3 days to localize the point of max intensity. And then ultimately, I got to where that knee doesn't hurt at all. And every single day for a month, I wore that patch. After about 2 weeks, I started to recognize that not only is the knee better, but my other joints were better as well. So he was right. You only need one patch. Ultimately, your brain will sort of sort things out and start telling itself it doesn't need to respond to pain. And these results are kind of corollary. There was a paper that was written maybe 2 years ago that talked about chronic pain, and that 80% of chronic pain is actually a psychological mind trick. And not to say you're not hurting, but to say there's a part of your brain that just wants to ruminate. It's kind of pissed off that it's hurting, and it just thinks about it, thinks about it, thinks about it, 80%. So if you can,
That's a lot.
that's a lot. So it is, so it just, when I saw his study and then I read that study and then I had my own experience, it occurred to me, so his patch must address that part of the brain. So his results independently, that's it, independently confirm this outside study that 80% of chronic pain is related to almost like a rumination or an OCD that your brain just naturally does as an emotional component to pain. And so this patch seems to help that, which in my experience was life altering, life changing, to the point where I started speaking more frequently about this. When he asked me to give a lecture at Super Patches a year and a half ago, I happily did so. And then he said, would you mind sitting on our medical board? And of course, I would very happily do so, simply because I know the technology works. It's very unique. I use it in my own patients after surgery. And it's a brand new company. So I certainly would love to see it in the hands of all doctors, all hospitals, because it,
As a tool, right?
as a tool, there's no narcotics in it. It's, so when we talk about pain management, the government is all up in our grill as doctors about, number one, it's the 6th vital sign or whatever. You can't allow someone to have pain. But wait a minute, you can't write for the narcotics either, because those are addicting and you're causing a drug problem, doctor. And we're in this bizarre rock and hard place. And then there's me. And so what's beautiful about this device is that it is inexpensive on a daily basis. It doesn't require a prescription, and there's no medicines. And I personally know it works. And everyone I've tried it on, it works. Is it perfect? No. But does it work? Absolutely. And it's one patch a day. So $2 a day. It's almost ibuprofen levels amount of cost. So we're not talking about a lot. If you're hurting, you're going to take 3 or 4 ibuprofen every 4 or 5 hours because you're in pain.
And let's talk about what that does to your GI
Sure.
muscle lining, the
Yeah,
risk
your
of
kidneys.
the,
Yeah.
the risk of ulceration.
Yeah.
I mean, that I mean
Yeah. So you've got,
the tumble effect of that.
of course. Yeah. Because
Even so, but I think there's always this, if it's over the counter,
it's
then
okay.
it has to be safe, right? I
Right.
think that what touch
Yeah.
on that for a second,
Yeah.
because
The rundown is,
people have a
yeah.
really misconception that, I can't get hurt or injured medically because it's over the counter.
Right. Yeah. The real problem, like, I mean, well, let's run them down. Between ibuprofen and Aleve, those are in the same over-the-counter categories. And yeah, they cause gastritis, they cause colitis, they cause ulceration, they cause kidney failure, and they can cause acute bleeding. Aspirin's in that same category. Okay, so you don't do that. You do Tylenol instead. Okay, great. That's liver failure. And
Right. Let's pick on another.
So the number
vital
one,
organ.
the number one cause of drug-induced liver failure is Tylenol.
But
And
it's safe though. It's over the counter.
it's over the counter. And a lot of our pain medicines, whether it's a Vicodin or Tylenol number 3, they all have acetaminophen in it, which is bad for your liver. If you're doing a narcotic, they're addicting. They cause nausea, vomiting. They cause constipation.
Right.
They actually worsen inflammation, which can prolong the painful state, which is why you get addicted, because you keep taking the medicine because you hurt longer. So people who have an injury or who have had surgery, which is a controlled injury, are slower to heal and slower to recover if they get a narcotic. Forget the addiction part of it.
Right. It shuts down that prostaglandin mediation, that cycle of inflammation, and how it's going to work through that process to help heal. And it elongates it, which is never a positive.
Right. And
any surgeon's world.
Right. So the patient wants to have one pill that they take that works immediately, but those pills don't really work that immediately. And then the patient winds up having multiple complications and whatnot. So the pain medicine is a challenge that we all are aware of as a
Well, if you think of okay, so narcotic, right? How does a narcotic work? Working on your central nervous system to block the signal to the brain. And how's the super patch work?
It doesn't even block the signal to the brain. It blunts your I care about the signal. So the signal is actually still there. You just don't care quite as much that it's there. But again, that is how Super Patch works. It blocks the signal to the brain, so you just don't care that the signal is there. So you don't ruminate on it anymore. It's similar. Now narcotics work on what we call opiate receptors, and it's a very different process. There's a lot of opiate receptors throughout your body. That's why it causes nausea, vomiting, constipation, et cetera, et cetera. Super Patch doesn't do that.
Right.
So the Super Patch is more like a biofeedback than it is anything else, because it resets the body to kind of like a normalcy. It can never make you hypo-normal, like blunt it to zero. A narcotic can make you stop breathing, right, and kill you.
Right. It can shut down your lung function.
Yes, it can, and that's what fentanyl does, and that's what kills you, right? So, so Super Patch is more like biofeedback. You're not going to biofeedback your way to zero. It's just not going to happen. There's no medicine involved in biofeedback. The biofeedback for the audience would be something like your iPhone has like a little, thing that you can watch and breathe to control your breathing, and you could test your pulse, and you can feel your pulse going down. When that happens, it's lowering your blood pressure. And when that's happening, it's lowering your breath. It's very similar to meditation. What you are doing with that, you're looking at your pulse going really fast. You're concentrating on slowing things down. You're watching your pulse go down, and it tells you I'm doing that correctly. That's what biofeedback is doing. you have to consciously be aware of that.
Right.
And you have to watch and be aware. And the second you stop paying attention,
you are putting yourself to that state.
correct. And the second you stop paying attention, all the effect is gone.
The doorbell ring, the dog
bing,
barks,
yes,
the
exactly.
dog barks, everything like beep, boop,
And
you know, everything.
Right,
You're,
and it's
you're
all
out of
gone.
that state, right?
And it's gone. Right, exactly. And you're out of the state. But so the state you're trying to enter into is one that is parasympathetic in its nature. So your body has the fight and flight sympathetic, and then the rest digest parasympathetic. All right. So the modern world has us stressed and we're in the fight and flight all the time. You get pain. Now you're
How was your drive? How was your drive home? Right?
Oh, it was so much fun.
Right?
Yeah. Well, yeah, right. Well, I have the aid of a super patch, piece patch, which we'll talk about some other time. Which
That's
helps
next. Is that next week? I don't know.
it should be. It needs to be. We'll
Coming
make that
up.
next week. That's my lead up to next week. But pain puts you into that fight or flight sympathetic tone where you're just on edge. And because you're on edge, your brain is constantly whirling through all the different ways the dinosaur is going to come get you. And that's what gets you into this chronic pain scenario. So your job is to get out of that and pull into the rest digest. You don't really care what's going on. You're chilling out at the beach. You're having yourself a good time. Your pulse is calm. Your breath is calm. So it's a calming. And so
Holiday, vacation.
I'm on vacay. Right. So, and of course, this is why people get addicted to pain medicines, because it kind of drugs you to I'm on vacay. Right. But it does it in a chemical way that's bad for you. Biofeedback, meditation. People will get addicted to meditation and yoga and even exercise and biofeedback, where you control your pulse with the biofeedback thing, because it makes you feel good, because it puts you in a parasympathetic state. The beauty of these patches is that it's putting you into a parasympathetic state, and it's very selective because there's a bunch of different pathways in your brain.
It's very distinct signal that's been
It's a very
created
narrow signal
within the patch.
Yes, within the patch. So when it hits your skin, that translates that signal to a nervous impulse, goes up the nerves to your spinal cord, goes up to the central part of your brain, and depending on the pattern on the patch, your brain will either shuffle it to the front for sleep, shuffle it to the back for balance, shuffle it out to the sides just a smidge so you don't give a damn. Right. So that's kind of how the patches are made. They've been confirmed with EEGs to make sure it's hitting that part of the body. And so once Jay finds a pattern that can kind of localize in one spot of the brain, he then puts it on people to see what symptom alleviates correlating to that part of the brain. So the part of your brain that ruminates on pain is in the amygdala. So it's like thalamus and amygdala, and they're going. They're doing one of these things. So this patch hits that pathway and calms it down.
It's spiky.
Because it was highly selective, and you don't have to think about it. It happens within a minute of you wearing the thing. In 95% of people who have been studied, these patches will affect the EEG change that it's meant to affect. So, and that's just the creation process of the patch. Pattern, what is the EEG? Tighten up that pattern, tighten up the EEG. Perfect. 95% of people who wear that pattern will have that EEG, period. Like that's how that works. And so, but with the second you take off the patch, the effect is gone. So you don't have to think about it, but it does have to be making contact with your skin. So that's the one caution I would tell people. It's got to make contact with your skin. You don't need more than one. When it comes to the pain, especially if you got multiple focal points of pain, it does help the brain's attention if you get that thing as close to or on top of the pain as humanly possible. That just sort of helps the brain sort it out. And once your brain realizes that's what you're trying to accomplish with this patch, then you wear it all the time. All your other pain will improve with time if it's a chronic pain.
Right. But you know, there's a lot of people with chronic pain, and now they're You're listening to Dr. Toker. They're saying, okay, 90 seconds. At least in my experience of just handing it over to people, putting it on them,
Yes.
the acute pain, they feel it.
Yes.
Chronic pain, like what you were experiencing, it took a little bit of time.
Yeah, it's like
Because you're almost like you've got to you're retraining your brain to
yes,
calm that signal.
yes, yeah, and it was
And the
coming from
longer you've been in that chronic pain
the
state,
harder it is.
harder it is to break through it, to go, no, this is okay.
Yeah,
This is
yeah,
okay.
exactly. Exactly. So I've had patients who they just had surgery and you could put that patch right next to the incision and all of a sudden they're like, huh. What's interesting is unlike pain medicines that'll kind of make you sleepy or you can't focus or you feel blurry, none of that is going to happen to you.
Right.
Because there's no drugs in it whatsoever. You just recognize that, oh, I walked across the room and I walked across the room. Wait a minute. How did I walk across the room? Like that. I mean, that was literally my experience. How the hell did I just walk up the stairs? What?
Right.
Amazing. It's like, and you almost forget that I'm not supposed to be able to walk across the room. So it really was.
Or that you haven't been able to for
a
X
year and a
amount
half
of time,
Yeah.
right? Like you just you execute it, you do it, and you go,
That's crazy.
you're like, wow, I just made it to the top of the stairs. I was carrying some laundry, some work,
Yeah.
but I didn't think about it. And
Didn't think about
now
it.
I got to the top and I go, oh, well, that was pain free.
Yeah. I mean, I was having to only use one leg and with both arms on both sides of the wall up the stairwell to get up the stairs. There was no other way for me to walk. Both of my knees hurt, but I couldn't use the right leg at all. And so for me to be able to walk up the stairs, look, mom, no hands, that to me was a miracle.
Yeah.
And so to be able to go and anyone listening to this who's had psoriatic arthritis or any kind of rheumatoid or autoimmune arthritis, just the act of going from sitting to standing is an act of freaking Congress. I mean, it took the amount of pain to change my position was stupid. It was obscene. It was stupid. And so just to be able to go from sitting to standing, like that was my party trick. I showed my husband. I was like, look, I just stood up.
Right. And I didn't even, I wasn't cringing. I wasn't clenching. I wasn't gasping, right?
You had to emotionally prepare yourself because you could feel the pain almost before you moved. You had to emotionally prepare yourself. You could get kind of halfway, your ass about that far off the chair, and you had to stop for about 15 to 20 seconds. And then you could kind of go 3/4 of the way, give that another 15, 20 seconds, and then stand up. Then once you stood up, you had to stand there for about a minute or two to let all the pain out of your body because now you're standing. Cool. There's no taking a step. You haven't taken a step yet. Right.
You just stood.
I just stood up. Right. And we have a physical exam finding, as you know, Rob, because we're doing that study on balance. It's called the get up and go test.
Right.
And like your longevity is directly tied to how much time it takes you to go from sitting, standing, and walking 10 feet, turning around, and then sitting back down. And for me, that was a 5-minute venture. Like technically, if you calculated that, I probably had like 4 years to live, this was not good, and so to have something so simple with no medicine in it, so my brain still works, I could still go to work, saved my surgical career. Obviously, I am in a great amount of debt to Super Patch and Jay Dollywall in particular as a result. So I can't say enough great things about it. That's just my personal experience. But I think if you ask around other people with chronic pain, they will have very similar stories. Does it mean I have no pain? No, it does not mean I have no pain, right? But it means I am a functional human being again.
Yeah.
Yeah, and I got like old person pain, but that's okay. I can handle that.
Right.
My joints are
and so you
swollen, but that's okay.
Listen, you're active. You're in the operating room. You are on the robot. You are.
Yep.
You can get in and out of your little sports car.
I
that-
can.
I mean, I mean, you would have been, you were on track to have the wheelchair up
Yes.
the back of the
Of a van.
of
Yeah.
the van,
Mhm.
basically.
Yeah, we would have not, my husband would not have bought a sports car for me if I were still in the state of disrepair.
We would have to peel you out of it.
I wouldn't have been able to get in it so low to the
Well,
ground.
we could throw you in like a sack of potatoes, and
You
then
would
and
just
then
find-
and then you have
Yes.
to, you know, hoist you out and
If they would come up with a personal robot who could just sort of like carry me out of a car, that would have been perfect. But anyway, so for anyone
much
out there
better
who
this way.
experienced it, yeah, I can't say enough about it. And honestly, the only thing that can make that patch better is that they came 30 to a pack, but apparently they're going to start packing 30 to a pack. Right now there's 28 in a pack,
right.
but it's a once a month monthly ship, right? So then you start to panic, and you buy extras.
An extra one. Then you got the
Buy extras. But now the patches are going to come 30 to a pack. And I still keep extras because if anyone in the office has a little pain or something, I slap them on there. But yes,
so where do you find yourself wearing your right now?
well, so I no longer wear it on my knee because
Right.
I don't need to wear it down there anymore. But that's where I wore it for 30 days.
Right.
I have a tendency because I want the thing to make contact to my skin and held in place in a spot that's not too sweaty, that doesn't bend too much. So I have a tendency to put it like on my hip, basically.
Mm-hmm. Tight
Right.
skin.
So it's not in a fold of skin, and I don't particularly. It's impossible to make me sweat, so I'm not going to sweat it off, and so it'll stay for that long until I take a shower, and then I peel them off in the shower because I wear more than one patch, and so my ass is littered in patches, and so I just peel all those off in the shower and I dry off, and about an hour later I slap them all back on, and then I go to bed. So that's what I do. Yeah.
Working. Yeah, no, I think you know, it's important for people to level expectations,
Yes.
and that you're in essence reformatting your hard drive.
Yes.
Think you think
Yep.
about if you think about having a virus in your software and think, okay, so now first I gotta locate it, isolate it, and
Yep.
now I have to get it so it's not affecting the performance of my computer, which is the performance of you as a person.
Yes.
And sometimes things take longer than others.
Yeah. Yeah. It's just like a control alt delete, so to speak. And each patch control alt deletes different networks within your brain, and it's a very temporary thing. The second you take the patch off, the problem can come back. So this is a physical therapy device. It's not medicine. It's not a cure. We're not diagnosing anything, but the expectation should be life is easier when your brain is in a state of homeostasis, and that's what we're trying to achieve. So is it perfect? No. Mm-mm. But you'll not find a perfect solution to this particular problem, in my opinion, as someone who operates on people who are in chronic pain and whatnot. And it's just, in my opinion, an awesome starting point. Between that, and a little bit of time and expectations, it's certainly.
It's a nice addition to how you
Yeah.
treat your patients. So
Yes.
from the pain management within your practice, is really going out to the
Yes.
surgeons that might
Mm.
watch a snippet of this. What's your protocol that you would then start them a little bit early, keep them on for X, and then if they
Yeah,
want, they can.
I
How do you do that?
Yeah, so in my practice, I run a narcotic-free practice. And when you consider the types of surgeries that I do, traditionally are considered quite painful.
Big,
Um,
just big surgeries. I can attest to that.
but I don't write for any narcotics. And how do I do that? So, proper nutrition, non-inflammatory diet is the first thing that I tell those patients. There are some herbal supplements that are anti-inflammatory. I will have people use turmeric and N-acetylcysteine are in that category. When it comes to these patches, I will typically suggest multiple types. The first is this freedom patch. And it is a good idea, in my opinion, to have it on there at least a day or two ahead of time, just to kind of everybody's nice and calm. Okay,
Okay.
before we get started.
I think if everyone walks in with some sort of
Yeah,
pain of some sort
hell yeah.
after
Well, and
after a certain age, everyone has something where they go, yeah, oh
well,
yeah,
and
don't treat it.
what I would say, one of the things that we learned, and they were doing a lot of studies on this when I was a resident about local anesthesia during surgery. And there was a big debate. Why do I have to give local anesthesia if the patient's under a general anesthetic? And it came down to, well, pain control after surgery would help the patient. Oh, okay. So we used to do the surgery and then inject the local because it would last longer. But as it turned out, if you inject the local before you make the incision, the patient has way, way, way less pain.
Yes.
So you can block the signal before pissing everybody off in the first place, the patient does better. Okay, so having said that, I like a little bit of a freedom patch on there. Surgery freaks people out. It causes a little bit of stress. It puts them in that fight or flight situation. So I want them to have a peace patch on. The other thing, yes, absolutely. The other thing that I have found in patients who have surgery, they get disoriented. They kind of like feel a little bit of dizzy because their blood pressure is doing all this, and the way we position patients in the operating room, the anesthetic that we give them.
Well, when you come out of surgery, right?
You're all
You're
goofballs.
literally like, where am I? Like,
Right. So for that reason, I will put a Liberty patch on people, and that's for balance. That's the patch that we are going to be that we're testing to help people not fall and bust their chops on a fresh incision after surgery. So those three things, and if they cannot,
not recommended.
Not recommended. And if they can't sleep, again, because I don't want them taking a drug that makes them groggy and whatnot, I have them do a REM patch, which we talked about last week. So those are 4 patches that I suggest to anyone who is having surgery. Then during the surgery, yes, I'm going to put in local before we make our incision. And after the surgery, we're going to make sure we have like a muscle relaxer on board. Yes, you're going to be wearing the patches even in the hospital, et cetera, et cetera. And so the course of doing that, those patients are more active after surgery. They have less pain after surgery. They're in and they're out. They're less likely to have a complication as a result. So that is what we in surgery call an enhanced recovery after surgery protocol.
Yep.
And so I have just kind of modified a lot of those steps to add the nutrition, a little bit of the herbals, and then the super patch piece. And it has made me enormously successful as a surgeon, despite how pain. And I've had patients who've had tons of surgeries and tell me, I don't understand why this surgery did not hurt me. I've had surgeries before. I don't understand that. This is the biggest surgery I've ever had. Why was it the easiest one? And it's just multifactorial, because
right.
we approach
You
it.
have 20+ years of surgery using traditional methods of narcotics,
Yes.
over the counter pain relief.
Yes.
And now
These
more
things.
recently now adopted this
Yes.
type of protocol into your
Yes.
practice to then go, oh, this is better for my patients, better feedback, and your surgery hasn't changed. So it's not, that's consistent, right?
Surgery is the same. The difference is the things that we've added. And, if you've got a patient who is about to have an operation, yes, it is 4 different patches, but you know what? If they make themselves an online account, become an associate, they get a 25% discount. The next thing you know, they're kind of they're set for a prolonged period of time as a result, because they're going to realize I can sleep at night, make that REM patch an auto ship. You're going to be out of your pain once you heal from this surgery. Then you just keep some in the drug cabinet in case someone twists an ankle or something like that, right? So,
and oh, by the way, all right, it's from just, I been traveling El Paso, Nashville, Sarasota,
yes,
Miami, New York, and
yes,
that was my week.
yes.
So I mean, and so sleep function, pain function, just moving function,
Sure.
that even your protocol, which is right here, these colors, right?
Yep.
So you kind of like the purplish, you got I call this infantry blue.
Yes.
This is your freedom, which is the red, and then this is like a
Yep.
purple and a turquoise or something, right? So this is still less than the Starbucks. Got it there.
Yeah, for sure. Airport.
This is still less. This is still less than my Starbucks, and I don't think
Correct.
I didn't get as much joy and relief out of my Starbucks as what you are prescribing for your.
So you're talking about $8 a day in the perioperative period of time, but again, if you are an associate getting a monthly shipment to your house, all of a sudden you're getting a perpetual 25% off.
Right.
And so the sleep, and you can change what they ship to your house also. You don't always have to ship the same little packet.
So I move mine around.
Me too.
I'm like, okay, I want to, well, you know what? I'm getting low on this.
Yes.
I'm gonna auto ship.
Yeah. And there are days where I'm wearing 6 of these patches, and there's days where I'm only wearing 1. So it just kind of depends on what's going on in my life, but I'm always wearing the blue one. I can tell you that right now. That's my peace patch.
This is the infantry blue.
100%. That is the one that I wear at all times. So
and the people around you probably enjoy you.
In the opera, surgeons, Rob, you're no stranger to surgeons. We can be persnickety little people, when things aren't going right, the F-bombs start flowing, you get short with people, especially if it's like someone new who's never helped you, and the equipment not working right, and the anatomy is not right. Difficult.
They didn't pick your pick sheet right, and your sutures aren't there, and you
right. So never
am I in the right room?
Right. Yeah. I've been doing this surgery, surgery in this room for 17 years. I've done 2,000 surgeries in this operating room. That card is never right. See, I'm getting fired up about it right now. And I don't look redheaded, but I was born as a redhead. And so my personality is very much a firebrand, as most surgeons are. I defy you to meet someone who's a surgeon who doesn't have this personality. But if I'm wearing my peace patch, then I can tell a joke and have some frivolity about my consternation, if that makes any sense. I still get
absolutely
persnickety, but I can do it in sort of a fun way.
You've raised your threshold of tolerance.
Yes.
That's exactly what it does. So that you gotta poke the bear a lot more.
You got to poke the bear a lot. And even when you poke the bear a lot and I fly off the handle, it's not nearly as bad. It's not nearly as many F-bombs, I'll be honest. You can ask anybody who's around me, and then it's very short-lived. And without the thing, I cannot say that's true. You poke that bee's nest, I will be a freaking hornet for the rest of the day. In fact, I might be that way every time I see you. Yeah, that's right. Every time I see you for days. So, and I can't help it.
It's the carryover effect.
Name a surgeon who's not like that, Rob. Do you know? And we could be the nicest, most normal people over a beer, but in the operating room, we got to have the stuff just right. It's our personalities. We want it right because it's for the patient. It has to be done right. I need it this has to be perfect, and nothing's ever perfect. So you're always like a little curmudgeonly, a little salty. You get a little salty when things are not perfect. But my peace patch, salt-free. It's like salt-free. Completely solid. And we'll talk about that next week.
That's kind of how I'm with the joypad.
There you go.
It takes like the little things will, before I would just
Yeah.
And that's like, it's like, oh,
Whatever.
I would, it runs off a little bit.
But it runs off. You know what? I have to admit, I've never done the joy patch because I've been so chill with my peace. I don't want to mess with my mojo. You think I should try a joy patch?
I don't know. I did it before the meeting because I was like,
All right.
I think
I'm
I
gonna
need
do
to,
it.
I think I need to try this. I tried it before the meeting that we had
Yes. In Orlando.
in Orlando,
Yep.
January,
Yep.
because I wanted to kind of cycle through these,
Yep.
and I hadn't taken it off.
Yeah. No. Well, okay.
I was like,
Let me pick a weekend. I'm gonna have to pick a weekend where I'm not in the operating room. I
right.
wonder can you peace and joy at the same time?
Well, he would say they're working on two different functions, right? One is
Well, they
one
are.
is well, I mean, if you think of
Okay. I will
serotonin, dopamine.
I will order some joy patches. I will order them. I'll order them tonight.
If I was next to you, if I could,
Right,
how
and
they
then
do, how they do that in the,
I had a packet. I gave it
and
to
all of a
my
sudden,
daughter.
a little piece comes through.
Yeah, my daughter does the peace and joy at the same time, but of course she's also like ADD and anxious, and so she's got the focus, joy, and peace kind of going because she's a 21-year-old college kid
That's
who
right.
is about to graduate with honors, by the way. I'm just going to throw it out there. So she's graduating with honors. I'm very proud of her. But anyway, thanks to these patches, she's off all of her medicines for the last 2 years because of Super Patch. I can't tell you how many lives the Super Patch has changed. It's been an absolute pleasure to be on their board and everything. But all right,
And not to be Snoopy, but it's just because I'm curious. But what meds was she on?
She was on, and
what did that program look like to get her?
Everyone listening will hear these stories. Both of my children are horribly ADD, both of them. Where would they get that from, I wonder? But
Are they adopted?
no, they're very much my children. So they're ADD as hell, and to function in school, because in modern school you can't be twitchy around in school. Like the teachers don't tolerate that, So we had the kids on ADD medicines. Now COVID hit, and my daughter was
So what were they taking? What was the drug?
My son is now on Adderall, but my daughter was doing Strattera first, and then she was on Concerta. Does that sound about right?
Yeah.
These are ADD medicines.
Right, like a longer acting.
The longer acting, so you don't have to take it more than once per day. The Strattera is not even
not supposed to give you an amp, a high.
not, and it doesn't. In fact, it makes them sleepy. They hate taking it. But the side effects of the ADD medicine were very weird for my daughter because she felt like, on the one hand, yes, she could focus, but everything kind of made her jumpy and anxious. And now it's COVID. And if you know any 18-year-old girls or 17-year-old girls during COVID, they all went lunatic time, right? TikTok was going with all the craziness and the world was just nuts. And that's not good when you're 17 years old and a little anxious.
Hormones.
And a hormone.
Throw some hormones to it too, please, people.
Please. So all right. So she got the ADD.
And they can't see the girlfriends, can't see
the friends. No, she did not have homecoming, prom, name high school experiences. She was a junior and senior, missed all of that during that period of time. She had none of it. Never had a homecoming, never had a prom, none of that. At her graduation, she got to invite 3 people, me, my husband, and my son. Grandparents couldn't come, friends couldn't come. I mean, like that.
And that was more than most of the country.
More than most of the country because we're in Texas. That's
everyone else did it virtually.
Right. Okay. So here she is. She's on the ADD medicines, feeling crazy and getting anxious. And then she was very brave and she told us she was feeling this way. And she asked, could she maybe go to like, would a therapist help? I mean, I'm having all this anxiety issues and I think it's COVID. And I thought, you know what? That's probably not a bad idea.
Right.
it's COVID, and you're a teenager, and let's have a professional. Okay, well, that
So
professional,
let's have a professional conversation outside of mom and dad.
yeah, not mom and dad.
Right?
She was just brave enough to tell us that she was having this issue. This is cool. I'm gonna let somebody else handle that because I don't know anything about that. Other than I was a teenage girl, I don't know anything about that.
Teenage girl that, then times have certainly changed.
No, times have changed, and I have to admit, I don't want to say autistic, but I don't have the same kind of emotions that my daughter has. And like, she's very artistic. She's very emotionally labile. She's very empathetic. I don't have any of that. I'm a surgeon. I have no empathy.
Right.
I'm
You're
robotic.
fix.
It's my personality.
I see a problem. We're going to fix it. And you're going to be humming, boop, beautiful.
Correct. And if I can't tell a joke about it, then I can't fix it. Right. So I thought, you're right. You need to see a professional. We send her to the professional. The professional writes for some kind of anxiety. Okay.
I'm putting my joy back on now.
Yes.
While you're talking.
So now she's on an ADD medicine and an anxiety medicine. And by now she's graduated high school and she's on her way to college. Now she's not at home. She can't tell us what's going on. She's having to manage by herself around strangers in a strange town 10 hours away from where her parents live.
Right.
So the anxiety gets worse. They start adding other medicine. And so this
the walk-in clinic.
Yeah, well, the therapist, she had a therapist.
Okay. Up there.
Actually, they were telehealth at Parkland at UT Southwestern. Right. They had a telemed psychiatrist and was doing the therapy. And to me, therapy is like you're talking to someone that you can't tell your parents or whatever. That doctor was writing prescriptions like crazy time to the point where the child was not functional. I worried, how is she going to make it through school? And we went up there to visit her, almost like to look in her eyes. And I'm looking at all these medicines prescribed to my child. And we're like, okay, no, not taking that. Which girl, as soon as the semester was over, she came home and we had to detox her from all these medicines.
Yeah. You can't just pull them off.
Yeah. So we didn't do a summer semester. We detoxed her from all the medicines. I made her do microbiome testing. Because she had gut health issues. Everyone with anxiety has gut health issues.
Right. Connected.
Hello. Yeah. They're totally connected. Okay. So they have gut health issues, are connected. And then we started switching her off of her medicines to Super Patch. So now she does focus instead of her ADD medicine. She does her peace patch when she's feeling anxious. And if for whatever reason the doldrums in life get her, she'll slap on a joy patch, right? So it's like, and that has changed her life and her world. And we got our daughter back. It's one thing to not be in pain and to be able to walk upstairs, but to get your kid back, it's invaluable. I told Jay, no matter what it is he wants me to do, I will help him.
Right.
The rest of my eternity for inventing this and saving.
That's the mom,
Yes. Yep.
Yeah.
I am forever loyal. The guy can call me at any point in time. I will drop what I'm doing and help him for that. So anyways, that's kind of what we were doing. And I've not tried the joy patch. I've always given it to my daughter, but I will. I'll do it.
I think you're going to love it, but I'm not saying anything because.
I know I'm going to try it. We'll see. No, because one of the things that I found is if people don't have a symptom or a problem, it may not actually help.
Valid.
So I don't really struggle with anxiety as much as I struggle with stress. And I don't really struggle with anger as much as I struggle with stress. So it never occurred to me to do the joy, if you're not hurt,
I don't think of myself as an unhappy person.
I bet you it must hit on the super piece. All right. Well, we'll see. I'm going to find out.
You're going to check it out this week, or are you going to wait? I'm
going to have to check it out this week.
So then next week, we're going to follow up with.
Yeah.
How you feeling on the joy pad?
Yeah.
We're running little experiments.
We're going to run a little experiment.
Scientific studies.
I'm ordering, and the company's pretty good. I will have these patches within the next 48, 72 hours. It doesn't take them long.
No,
So I'll have a few days down the hatch.
before
Which may or may not
before
be
next Friday.
before next Friday. Yep.
And that's a perfect place to end.
All right, cool. Let's do it.
So now
All right,
we've talked about the having better sleep, having some pain management protocol with the Freedom,
Yes.
and we just did a little smidge of peeking into the products that help your surgical practice, as well as that 18-year-old teenager, boy, girl, doesn't matter. It's just it's society right now that these products can
COVID. Yep.
help increase their focus, their coping, their management, their stress management. I think it's there's to your point, if you're not getting benefit, give it a little bit of time. Gotta let it do its thing. So let it run through, and then see if there's some upside to it. And if there's not, you're out, $5. I mean, everyone's had a bad meal, right?
Yeah.
They've left the restaurant. How was dinner? And they go, it's fine.
Yeah.
Not gonna go back, but
Yeah. Very good.
So Joy Patch ordered for you.
Yeah, I'm doing it right now. Having a look. Is it under wellness? I'm shopping.
So for all the people that will catch little sound bites about our super happy hour,
Yes.
you can go to the Arms Medical website, link right there. You can go to drannatoker.com and there's a link there, and you can get your product.
Yeah, absolutely.
Try it out.
Yep. I'm ordering right now. Right there. There it is. Boom. It's on my little phone. All right.
Done.
Yeah. And I take my 25% discount. Thank you very much.
That's right. Oh, and I think they got a promo coming. They're doing something right with the 4 patches, and
they do. And I don't know all the details. What did Terry tell us? That starting in April, if you buy 4, you get the 5th variety free.
Yeah.
And that's on top of your 25% discount. So, I mean,
but I think they're gonna, if you go to the website, I think everyone can benefit from something in this product line, and then of course, and you can see whatever specials, and they're always looking to try to bring more value to you, the customer, and for us, bring you relevant information that can help give you a better quality of life.
Yeah,
that's
absolutely.
what we need. Week in, week out.
Exactly.
All right. You have a wonderful weekend.
Yeah, you too. Patch is here. It's on its way, and we'll talk about it next week.
Okay.
I gotta go to my face to get my Apple Pay to pay for it.
There you go.
Okay, good.
Bye.
All right, bye.